Incontinence affects men and women in similar and different ways. First, we'll address the issue with women. There are essentially two types of incontinence. First type is what's called stress incontinence, and the second type is urge incontinence. The difference between stress and urge incontinence is that in stress incontinence, the person that has stress incontinence will lose the urine when they cough, when they sneeze, when they exercise, when they get from the chair to the erect position, then they get from the bed out of the bed. Any increase in intra-abdominal pressure will produce leakage of urine, which is called stress incontinence. The other entity is urge incontinence. Urge incontinence is loss of urine when somebody has the urge to go to the bathroom, does not make it to the bathroom, and will lose the urine. It can happen to anybody. In women, we see it as age progresses, there's less support to the urethra, and there is more incident of stress incontinence. Sometimes, after having multiple deliveries, the support of the urethra decreases and increases the incidence of type 2 stress incontinence. The urge incontinence, on the other hand, is usually secondary to bladder instability. And that can affect, as I stated before, men and women. It is much more prevailing in women that we see urge and stress incontinence. In men, we see incontinence are related to urge and to issues that are related to prostate problem that can create incontinence. But most of the incontinence that we see in men is stress incontinence resulting as a complication after surgical procedure. Surgical procedure on the prostate, either for benign disease or most commonly for malignant disease, when people undergo radical prostatectomy, can result in variety of degrees of stress incontinence, from complete loss of control of the urine to partial loss or intermittent stress incontinence. Most of the people that have stress incontinence, when I talk to them, it's issue of lifestyle. And depending on the degree of the stress incontinence, that will affect your lifestyle. And some people that have severe stress incontinence are afraid to leave the house or have to wear constantly diapers and change them or wear thick pads. Most of the women that we operate for type 2 urinary stress incontinence undergo a minimally invasive procedure that can be done as outpatient. They have the surgery in the morning and they go home a few hours after the procedure. Most of my patients will leave the hospital without a catheter and will gain control of their urine and will not have stress incontinence immediately after the procedure. So you don't have to wait a certain amount of time to regain your control. Very few women will leave the hospital with a catheter for 2 or 3 days, and when the catheter is removed in the office, they will be able to void on their own and will not have any longer stress incontinence.